Good evening, everybody. Thank you so much for joining us for tonight's patient educational webinar presented by New Jersey Plastic Surgery. Very excited about tonight's topic. Your presenter tonight, Dr. Matthew J. Travato, great plastic surgeon. Impressive bio. I'll let you read that entire bio of his on the slide while I'm talking. But really what he specializes in is what we're talking about today. And it's this concept of a holistic approach to not only plastic surgery, but also just aesthetic medicine in general, and how to restore your body, your mind, your will, your everything to its full potential by using a multimodal approach, something that Dr. Travato will explain further. He's a pioneer in that. And Dr. Travato, as many of you may be aware, he works alongside Dr. Barry DiBernardo at New Jersey Plastic Surgery. He also has his own practice in Texas as well. And he has a program called Thrive MD, which you will learn a little more about, that uses a combination of treatments, hormone therapies, things like that, to really allow today's modern 21st century man to look and feel their best, as we said in the title, from the boardroom to the bedroom. So without further ado, I'm going to go ahead and bring in the man himself, Dr. Matthew Travato, and he's going to go through this again. Ask your questions through the Q&A tool, through the chat tool. Keep it very interactive. And you're going to be hearing from three different people, real-life patients who have undergone different treatments that we're going to be focusing on. They'll be coming in for a live discussion with Dr. Travato, just so you can get a better sense of what's involved.
Thank you, everybody, for attending. Let's get started with this. This is a big topic. And we're really going from head to toe, literally. The purpose of this webinar is basically to showcase all that we can offer our male aesthetic patient, both surgical and non-surgical. And so we employ the entire array of procedures, techniques, technologies, supplements, medications, pharmaceuticals, hormone therapy in order to achieve the best results for our patients. We basically want every patient to be their best self. And sometimes surgery alone isn't the answer. We need the broad array of options for our patients. Particular, our male patients, they don't necessarily want plastic surgery. They don't necessarily want to look like they've had surgery or feel like they've had surgery, but they want to look focused. They want to look sharp. They want to look rested. They want to look confident. Older patients still have to compete with younger counterparts in the boardroom and in the sales force, et cetera. And so this is very much geared to those patients. This is one of my favorite authors, and basically he drives home this point that some of the best inventions come from the combination of two different areas of other inventions. And so taking a 30,000-foot view of something and being able to couple two different special things into a third special thing is basically where a lot of value can be derived. And that's really what we're doing here. We're using what I call a multimodal approach. And so any given patient might be changing the way they do their vitamin supplements, the way they do hormone therapy, the way they do procedures or skincare. And we combine all of those things in order to achieve the most natural and best result for our patient. So let's get started. We'll go from hair to toe. I want to showcase all of the tools and instruments that we have at New Jersey Plastic Surgery. So in particular, with hair restoration, one of the most important things is to be able to quantitatively measure what the deficiencies are, what the problem is. And so having the right tools is probably the most important thing, along with the right procedure. But having the right measurements guides you to the right procedure and then is able to measure the results afterwards. And so the hair metrics assessment is very important. All the photographic and videographic tools that we have at our disposal at NJPS are so important. Non-invasive, non-surgical hair optimization is very important. This right here that you're looking at is called a laser cap. It's not the same laser cap that you see on Amazon or Costco or late night television. This is a truly medical grade with the number of lasers, with the power of lasers that you're not going to find elsewhere. And so this is our favorite device for hair optimization. The way it basically works is that laser energy infiltrates into at the cellular level of the hair follicle, stimulates it, has that hair follicle making more ATP, basically more energy, so revitalizing it, releasing nitrous oxide, which is that NO, that's what opens up blood vessels. And so it also reduces inflammation, which is where you see that IKB little deal over there. So reducing inflammation, increasing blood supply, increasing energy is how you promote a healthier hair follicle. So that's our laser cap. Here's some results: 6 months, 8 months, 7 months, 10 months. Basically, this is something that the patient wears at home at night. It's not something that they're wearing 24/7, but they're wearing it every day. And these are real results, real patients. Let's move into the vitamin supplementation for the hair follicle. So out of all the different vitamins and supplements that we've researched and looked at the New Jersey Center for Clinical Research, we found that Healthy Cell gives us the best result, not only for hair follicle health, but also skin and in general. And the reason why it does that is because this is really the only supplement that the absorption of the actual vitamins and minerals that are in the pill is extremely high. So regardless of what's in the supplement, the important component of that is whether it actually gets into your bloodstream. And the only way for it to do that is by getting absorbed in your intestines. And we've shown that Healthy Cell Pro is the ideal supplement for those reasons. So laser cap, Healthy Cell. Now we go one step further into a more surgical or procedure approach to hair restoration. These are examples of patients who have had follicular unit grafting. Here's before and after. Here's a patient, very, very substantial result. It looks natural, it's subtle, but it's significant. And that's what we're going for. We don't want an unnatural result. We don't want somebody to look like they've obviously had follicular unit grafting or hair restoration. This is a patient that we can interview right now. He should be standing by.
Yes, I'm here, doctor.
John, thank you so much for taking the time tonight. Can you just give us, the audience, an idea of what it felt like to go from the before to the after, some of the considerations, what went through your mind, and what would you tell somebody who's listening in tonight and kind of thinking about whether they would want to do what you did?
Okay, I'll do my best. I think I have to kind of go back in time a little bit about my experience, having a full head of hair in my teenage years, and then slowly in my 20s and 30s starting to see my hair thin out. And it was looking in the mirror every day, I noticed I started looking different, started looking older. And I used to spend a long time trying to just to get it just right, so that when I'm out in public, people wouldn't notice. But then that, precluded me from, swimming and some of the events, a windy day, a sunny day where kind of the sun would you just see your scalp if you're standing in the sun. So I started to feel self-conscious about it, and I knew I had to do something about it. And both personally and professionally in my business. So I decided to take the step. I did some research on it. I found the right doctor, and I went and learned about the process. But for me, I was already sold. I understood exactly what it was, what was about. I've seen some people get their hair transplants, basically, I would say just moving soldiers forward, right, to the front lines. From that standpoint, and finding the right doctor, I was really excited about getting the process done. Now, after getting the process done, looking in the mirror, I looked younger. I felt younger. People noticed a difference about me, and I didn't have to worry about the way my hair looked or if I was swimming or standing in the sun. Ultimately, I'm looking forward to different technologies as we go on. If it's cloning, I think that if I have more hair to bring forward, I would be doing that. But it really felt my confidence level went up dramatically. And I look at my friends. I look at my friends that we're not all Bruce Willis and Jason Strathman, whatever his name is. Some people can shave their head and look great bald. That's not everybody can do that. So, but for me, you go back when they had hair, they look better. In my opinion, they all look better. So I was really excited about it. I'm happy I went through with it. It was one of the best decisions that I've done. And for that reason, I guess that answers your question.
Awesome. Thank you so much, John. I'll just keep moving. And, John raises a point that a lot of it is how people are responding to you. You feel great. You're sitting across a conference table or whatever it is, and you might feel great, but to the person on the other end of the table, you might just look older, not rested, worried, and that plays on them as they're interfacing with you. They, if you're negotiating against them, they feel like they have leverage on you. And so that's part and parcel what the talk really is about, is that, we want you to look as good as you actually feel. We want you to look healthy and make that a presentation. So moving from hair, let's move down to the eye and the brow. This is a very athletic 60-year-old man who just felt like his eyes made him look tired all the time. And that he was starting to see in pictures that the top half of his eye was covered by his eyelid and his eyelashes. So we performed an in-office procedure under local in under an hour to basically perform an eyelid lift. And you can see from the before to the after, you're seeing more of the blue part of his eye. He looks like he has more energy and he looks more forged. And so it's a subtle yet significant change. He doesn't look pulled. It doesn't change the shape of his eye. And so he's very happy. And again, very active patient. You can see from the before to the after. Again, there's just that redundancy of skin. Here's another patient. You can see the same thing in his upper eyelids. He just felt like he looked tired. And so with a very simple in-office procedure performed under local anesthetic, we've now cleaned up that upper border of his eye, and he now looks like he has more vitality, more energy, more intensity, you might say. Here's another patient, very healthy, very active, 63-year-old gentleman who just felt like his eyes looked tired or swollen. And so in office, again, in about an hour and a half, he underwent upper eyelid and lower eyelid surgery. And you can see a dramatic difference. It's still him. This is still the same Tommy, but he almost looks like he's lost weight from before to after. So again, subtle yet significant. Older patient, 74, but very active business owner. And he, again, same complaint. I feel great, but I look tired. And so we addressed both his upper eyelids, his lower eyelids, and we also elevated the position of his eyebrow all through, an upper eyelid incision. And this was a surgical procedure, but very effective nonetheless, very happy patient. And now he looks the way he feels. Let's keep moving along. We'll call this the midface. It's the middle third of the face. So take a look at this video image of this patient in his mid-60s. And I want to freeze this on one particular aspect here. If you look at his right cheek, I'm going to see if I can do this. When he's looking towards his right, if you can follow my mouse, you can see the contour of his lower eyelid into his cheek, and then there's a hollow area, and then there's another roll and then another hollow. And so in a matter of 20 minutes in the office with local anesthetic, with no downtime, we were able to use a off-the-shelf filler in order to create a more natural contour, a more youthful contour of this patient's midface and cheek. We revolumized this middle third of his face. Again, no downtime, off-the-shelf products, but a very significant result for this patient to restore the volume that is lost with aging. The nose ages too. That's not necessarily the case in this particular patient, but a more curved nose with a hanging tip or a deprojected tip connotes age. And so with a simple surgery, we can refine the dorsal line of the nose and elevate the nasal tip as we did in this patient. 1 week recovery, and this patient has a great result. Let's keep moving along down to the jawline. So when you first meet somebody, subconsciously, your first impression when you look at their face comes from their jawline. A nice, clean, sharp jawline with not too much fat hanging underneath connotes youth and vitality, whereas a blunted or amorphous jawline with a large, turkey neck connotes unhealthiness and age. So here's a patient with a quintessential aging neck. This patient is an extremely active 73-year-old gentleman, still runs businesses, still does a lot of real estate, constantly doing construction projects it is at his home. He just felt that he has a lot more energy, but it doesn't look like he does. And he wanted to know what could be done. He has excess fat in his neck. He has loose skin. He has hanging muscle. And so we are able to offer minimally invasive, minimal downtime in office procedures under local anesthetic that can address this patient's concerns. And here's a quick run through of a relatively new procedure that we've been performing for the past couple of years. Before this procedure, we were performing a similar procedure that's been around for about 20 years. What this procedure does is it makes it even less invasive than the previous way of lifting and elevating the neck. So we combine a suture suspension procedure that you see here with skin tightening and muscle tightening energy devices. And we're able to achieve very natural, yet very significant and long-lasting results. Here's a patient who's a very successful business owner. And he came in and he just felt that he just looked older than he should look. He's in his late 50s. I think he looks very good in either picture for late 50s, but he wanted to look better. We performed upper and lower eyelid surgery. We performed face and neck lift on this patient in the more traditional method. But the reason why I put Peter into this slide deck here in this webinar is because even when you look at his skin, he just looks healthier in the second picture. He just looks cleaner and healthier, and his skin tone is better. And so we, at the same time, performed a laser resurfacing for this patient. So laser resurfacing and skincare are also very important and can be combined with some of these other minimally invasive procedures.
And Dr. Travado, sorry to interrupt, but before you go on, I just wanted to point out, because I know that you and Dr. DiBernardo were really on the front lines with the MyElevate,
Yes,
the neck lift. And I know I'm looking at the poll results of the biggest concerns about possibly getting this treatment done. And it looks like the majority is worried about a long downtime recovery. And your first slide for that MyElevate, the first thing people see is their neck and their jawline and the zoom lift, the zoom factor, which I think even motivated that one gentleman that you had. Now, because of COVID, there's so much focus on the neck and the jaw area. I think it would be good, based on what I'm seeing in the polls here, if you could just take another 30, 60 seconds to kind of break down for that MyElevate why it's so attractive and appealing of an option.
Okay. It's an appealing option because it is very adaptable for a younger patient in their late 30s, early 40s who just wants more definition in their jawline and a more crisper, sharper neckline. The MyElevate procedure can be adapted for that patient, coupled with liposuction and some skin tightening. All of this can be performed under local anesthesia. The downtime is a matter of the swelling and bruising that comes more from the liposuction part, not from the Elevate part. The Elevate really represents a way to create a ligament, if you will, a suspension, in order to create that jawline, that cervical mental angle, we call it, but basically creating that angle from what's the opposite of that angle in many patients, where the chin just blends right down into the chest. Now, this patient has a very nice, but yet natural angle. And so that downtime for this patient is back to totally normal in less than 2 weeks, back to work in 1 week. And in terms of pain, these patients typically don't even get postoperative, they don't even require narcotic medications. And so it's a very safe procedure for the older population. It's a very safe procedure, and again, adaptable, so that from 35 to 45, we do liposuction, energy, elevate. From 45 to 55, maybe we do a small incision behind the ear to pick up some of the redundant skin in the neck and help that tighten that a little bit. And for the 65 to 75, we slightly create yet a longer incision and couple that with the MyElevate and are able to deliver that in an older patient without the risks of a hospital stay, without going under general anesthesia. Of course, every consultation is individualized for that patient and their medical history, et cetera. But this is an excellent alternative for patients that want a subtle but yet very significant improvement in their jawline and their neck. So again, just to take Ronnie's point home, I mean, having this broad array of tools and techniques and instrumentation and devices is what separates us from the rest of the plastic surgery practices and offices. Because when you have every tool at your disposal, you can truly personalize and individualize your treatment of that patient and that patient's concerns. So up into the skin now. Let's talk a little bit about the skin. Same thing with the hair. Having the ability to quantitatively measure the deficiencies in the skin, just like with the hair, is the key. And having the ability to repeat those same assessments after the patient's been treated or having treatments in order to know the improvements we're making is so important. It allows you to pick the right treatment for that patient. We've done in-house studies on multiple different brands at the New Jersey Center for Clinical Research. We've honed in on this particular brand of products, mainly because these are pharmaceuticals. These are topical, pharmaceutical grade skincare. And we've shown that the way that the topical penetrates into the skin, into the nucleus at the cellular level, that it alters DNA, that there are epigenetic changes that are occurring, is what really made us very excited about this particular underskin brand. We've shown that the pore reduction is there, pigmentation reduction is there, even the blood vessel reduction you can see from left to right, the area of redness. We've shown in 2 dimensions and now in 3-dimensional views, the texture of the skin improves, as you can see from top to bottom. The collagen production increases by over 30% with patients that are on the underskin regimen. And you can see that here with the ultrasound views that we have. So coupling topical pharmaceutical grade skincare along with any of the other treatments, both invasive and non-invasive, that we're doing are key. So multimodal approach. Also, to treat the skin, we have the most vast array of devices that anyone can get their hands on as a clinical provider. Broadband light, intense pulse light, Hero, the Halo, which is a unique system that uses 2 wavelengths of laser. So you're basically getting 2 treatments at one time. The Cyton, which is an erbium, both fractionated and ablative. I know I'm throwing a lot of words out at you, but I want you to recognize that we have such an arsenal for every skin type, for every deficiency that we want to treat, and for every amount of downtime that the patient comes in on consultation requesting. And so if a patient is wanting more of a result and accepting more of a downtime, we'll go in that direction. Morpheus and Genius are both radio frequency technology devices that use tiny little pins to deliver energy deep into the skin and thereby stimulate it and make more collagen. We have the face tight and neck tight technologies, which deliver radio frequency in order to tighten the skin and soft tissues. Here's just an example. It is a female example, but it's an example of a patient with an aged looking upper chest. You can see the brown spots and the vascularity, both addressed with the broadband light. Gynecomastia, or man boobs, now we're moving on to the body, is one of the most common things that patients want addressed. This particular patient is in his mid-50s. He lost a lot of weight. He's made a very significant life change with the weight loss, and now he wants to look as good as he feels. So we performed a breast reduction, male pattern breast reduction, and an abdominoplasty at the same time. So this patient was able to get those two procedures simultaneously, and that's a very significant yet natural before and after. Here's a younger patient with male breast. The gland is very thick. You can see in this picture. Makes this patient not want to go to the pool when he's on vacation. He wears a t-shirt when he goes to the pool. So with a single surgical procedure that combines energy-based liposuction and surgical excision, we were able to deliver this result for this patient with a minimal scar. Move down to the tummy. This patient came in because he also started going to the gym, lost a lot of weight, watched what he eats, but now when he wears a shirt, there's a redundant skin and suprapubic or area in his lower abdomen that just makes his pants not fit right. And so we performed an abdominoplasty, minimal downtime, 2-hour procedure for this patient. And now his pants fit him very nicely. And he feels great. He put the work in, he lost the weight, he's in shape. And all he needed to do was clean up that redundant skin. Here's another patient that made a very significant lifestyle change. He started losing a lot of weight based on that change, but still couldn't lose that fat tire, that mid abdominal ring of fat. He also had a lot of skin laxity and loose skin. So for this particular patient, we performed a 360-degree, meaning all the way around abdominoplasty. We performed a male pattern breast reduction, just like in the other patient, cleaned up all that skin. And then we also performed something we call a flankplasty, which was basically tightening up all that back skin the same way you would if you were making a suit fit your body a little bit better. So this particular patient had a complete lifestyle transformation. He did this naturally. We assisted him with preoperative hormone therapy. We'll get into that a little bit more. We did his body lift, his gynecomastia, his flankplasty, and then we had him continue on postoperative hormone therapy, basically to optimize his result, to optimize his healing, to minimize his downtime, to minimize his postoperative pain, to improve his muscle mass, to reduce his fat, to increase his metabolism, basically everything that you would possibly want to have. And this is Dan. And if I could, I'd like to bring Dan on to answer a couple of questions. Dan, thank you for joining us. Thank you for sharing your journey with us. I was wondering if you could tell the viewers, considering doing any of these types of surgeries, considering coupling surgery with hormone therapy, for example, testosterone or growth hormone, the things that we offer our patients, knowing what you know now and looking at your before and afters now as a competitive bodybuilder, I was wondering if you could share, whether you think it was worth it. Would you do it again? Just share some of your thoughts about it.
Sure. It was honestly worth every penny. It wasn't just a physical thing. It was a mental thing with me. So, I lost 150 pounds because I hated the way I looked in the mirror, and lost all that weight and still hated the way I looked in the mirror. So it was, to get the skin removed was just a game changer. My confidence went up. Growing up, I was a chubby kid, so I swam with a shirt on. And as an adult, I swam with a shirt on. And I walked out on stage in man panties and posed for a bunch of people. So I guess you can say my confidence definitely went up. And
yeah, I would say exponentially.
Yes. And the hormone therapy, that just was icing on the cake. Really kind of just revitalized me. I feel like I'm 20 in the bedroom, and, I keep up with the young kids in the gym. So, I can't really complain about that. So,
well, that's awesome. Dan, thank you so much for sharing. I can't wait to see you back in the office again and figure out what else we can talk about.
We might have to do some of that hair stuff. It looks pretty interesting.
All right. You got it. Thanks, Dan.
Thank-
So multimodal approach, meaning whether it's surgical or non-surgical or skin resurfacing or topical skin or some of the other non-invasive procedures I'm going to talk about, optimizing our patients from a medical standpoint is very important to us. So vitamin supplementation is one really important thing. And now let's talk about, the other aspects of men's aging. So these are the 4 complaints that we get all the time. I feel tired. My memory and my sharpness, my mental focus is not quite there. I have a loss of libido and sexual performance. And I just feel like where I'm putting fat, the shape of my body is changing now. These are the most common things, and they all come back to the same thing, the same reason. Testosterone. Testosterone declines with age. We've all seen the commercials for low T, etc. Testosterone reaches a peak at 20 years old, and from there on out, it goes down year over year in a linear way, to the point that by 50 years old, half of the men out there have what's considered low testosterone. And so coupled with that is that the estrogen levels in the male rise. So you have a declining testosterone, and then the estrogen is going up at the same time. So it's like a double whammy, because not only are men losing the muscle mass and the metabolism that goes with that, and the ability to recover from exercise, they're also gaining fat or depositing fat in the places that they would least want to have that fat. And at the same time, estrogen really does not help at all for sexual performance. Men go from a more anabolic metabolic state to a catabolic metabolic state. And this goes everything from muscle, which is what everyone thinks about, to sexual performance, erectile dysfunction, to mental performance. Testosterone is probably one of the most important hormones that acts on the brain in terms of confidence, decisiveness, mental sharpness, mental focus. And this is something that is underreported and not really talked about. We have a lot of patients that end up discontinuing their antidepressants once they're on testosterone. And I see that as a good thing, but we're coupling that with that general sense of anti-aging and wellness. So that's testosterone. Other favorites in terms of supplements that we use are growth hormone, which improves muscle mass, sleep, energy, mood, reduces body fat. You recover from exercise and injury, meaning surgery, better. We see that our surgical scars are improved. And that's one of the things I probably could have even asked Dan, because his scars are phenomenal. And we had him on the growth hormone precursor perioperatively. And we see a lot of this. And this is probably going to be one of the biggest trends in medicine coming up. Increased libido and performance, improved heart health. There are other designer peptides. We work very closely with our compounding pharmacies and the pharmacists. And there are always new and safe peptides on the horizon. And these are things that are naturally occurring. They are not hormones. And that's what makes it very exciting, because they are very safe and have no side effects. For patients that just have a certain goal in mind in terms of looking better, maybe a vacation that they're going to take in 2 months or 3 months, or a wedding, someone's daughter is getting married, or someone themselves is getting married. We have options for weight loss that are safe and effective. And so we take all of these things into account when we're performing our consultation. I'll just make a quick mention of IV therapy. We have ways of delivering vitamins, minerals through an IV, and most often it's in combination with an in-office procedure that a patient is already getting. So just like the patients you saw at the beginning of the talk where we were doing their eyelids, we're doing their laser, that's the perfect time for us to put in an IV and give somebody an infusion of vitamin C, vitamin B, calcium, magnesium. And this gives a patient an energy boost and repletes all the deficiency of vitamins that they have. And so this is also a very nice combination therapy that we like to offer patients. So for example, what we like to do is combine that IV therapy while the patient is numbing. We have the upper blepharoplasty that's being performed. The patient can get a full face laser to resurface their skin. Post-operatively, they're taking the peptide therapy to improve their healing and their scarring and reduce their recovery. And so I call it an executive refresh because oftentimes the male patient is very concerned with the downtime. And Ronnie alluded to this, and this was probably in the poll tonight as well, in that, yeah, great. What's the downtime? I can't take more than 3 or 4 days. I want my eyes to look better. I want my skin to look better, but what can you do for me with recovery in under 5 days? And so let me bring Steve, if I could. If Steve is there, I'll talk about combining a couple of in-office procedures together and having a minimal downtime, minimal recovery in-office procedure.
Good evening, doctor.
Thank you, Steve, for joining us. Thank you for participating. So how important was it for you in terms of the downtime, getting back to work and being able to do all of the procedures minimally invasively and in the office setting?
I really think that for me, that was, probably the main thing, after doing a lot of research and so forth, is the downtime and so forth. And I can say, now being 3 weeks in, and I can say, it was minimal, and honestly, there was no pain. I felt, coming out of it, very confident that, everything was going to turn out like I did, or actually how I did. And then of course, doing the research early on and trying to understand the procedures and trying to answer a lot of questions as well for me, so there was, my mind was pretty much made up when we came in the door, to talk to you the first time. But it was just understanding more, and you explaining more, as to the procedures. But, having both, my eyes and the laser rejuvenation, I'm very satisfied with it, and the results and so forth. And I've gotten a lot of compliments, and people just look at you. They notice something's a little different, but they can't put their finger on it. So, but even my wife, she looks at me. I find her looking at me, and she said, you look brighter. Your eyes look brighter. And like I said, we're 3 weeks in, and we've I'm certainly pleased.
All right, awesome. Thank you, Steve, very much. Steve brings up, and really encapsulates so many great points there, because we want the result to look natural. That's what men want. And we want someone to notice that it looks better, but we don't want them to notice because it looks like we had a procedure. We want to appear more rested, but when I hear a patient say that somebody came up to them and said, hey, did you go on vacation, or what did you like cut your hair, or what happened? Did you lose weight? To me, that's a success, because that's what we want. We want them to subconsciously and consciously notice, but have it not appear that they had a procedure. And certainly having a minimal downtime is part of that, because Steve was probably back, doing Zoom calls within 5 days. So I'll keep moving here. we're moving down. So Steve, we're putting it all together between combining the in-office procedures, combining that even with IV vitamin boosting and growth hormone therapy, and putting as many things that we can together for a patient so that they maximize that hour of their time and their recovery is minimized. Let's keep moving down. So in terms of sexual performance, we have supplements. We have your general health. There are supplements that help dilate the blood vessels, increase blood flow, that increase nitrous oxide to increase blood flow. We have Viagra, Cialis. We also have electromagnetic therapy. Yeah, that's what I said. Electromagnetic therapy. Emcella is a FDA cleared device that provides entirely non-invasive, non-painful electromagnetic stimulation to the pelvic floor musculature. And what that does is it increases blood flow. It increases circulation. It increases the neurogenic sensitivity or the sensation to that area. And so for both men and women, by the way, but anything that increases blood flow to the pelvic floor, anything that increases sensitivity and sensation to the pelvic floor and strengthens the pelvic floor musculature is going to be excellent in terms of sexual performance. So a patient sits in that chair, like you see here, and in a matter of 30 minutes, non-invasively, 6 treatments, the patient has an increase in their function. The same technology, electromagnetic stimulation, has also been proven. And when I say proven, I mean with flying colors, proven. They've combined that electromagnetic therapy with an additional type of energy, which is radio frequency. And so to combine those 2 different types of treatment at the same time to deliver the heating and the stimulation allows for patients to have a fat reduction procedure, non-surgical, and a muscle building procedure. So 30 minutes, 4 treatments, the patient will have 30% less fat and 25% more muscle in that area. Now, I'm not talking about the pelvic floor anymore. This Sculpt treatment, Sculpt Neo, these paddles can be placed on any muscle area. The abdomen is the most common, but we have patients that request it for their gluteal area, for their thighs, for their calves, for their biceps, for their triceps, anything that we can put these paddle applicators on for 30 minutes for 4 treatments, that patient's going to see that increase in muscle and reduction in fat. Here's a couple of before and afters. You can see there's fat reduction, and you can see that there's tightening of that abdominal wall, especially in that second procedure. Here, this is a female patient, but nonetheless, you see the tightening of that gluteal musculature because the shape and the projection of the gluteal muscle has improved. So I'm going to try to start to wrap this up. Again, the purpose of this talk was to give our attendees a perspective on what is out there and how many things can be combined and personalized for them based on their consultation and their concerns. And at New Jersey Plastic Surgery, we develop and have access to the latest techniques, technologies, surgeries, non-invasive procedures, supplements, therapies, both medical, pharmaceutical, topical, injectable. And because of that, because we have the broadest array of options to work with every single patient, we are able to see over the horizon. We are able to see, and we develop, along with the industrial partners, we develop the procedures and the surgeries that patients are going to be looking at 5 years from now. And so in terms of a practice, a plastic surgery practice to come and do a consultation for both men and women, you want to go to a practice where they have every tool at their disposal and can offer you a personalized, individualized plan that takes the entire array from the surgical to the non-surgical to the topical to laser treatments and puts that all together for you. And that's how you'll get, and that's how we get the most natural results and the most satisfied patients.
What would you say to anyone who is on the webinar right now who is interested, but they're hesitant? And, you know, because I know you've dealt with a lot of patients and you've done this for a lot of men. So what would you say to them if they're still a little hesitant?
I think the key is coming in for a consultation and letting us have that conversation to see what the real concerns are and adapting a plan based on the amount of recovery that patient has an appetite for, the amount and type of surgery that they may or may not want. Basically, we can tailor based on the array of tools and technologies that we have. We can tailor something that's going to give any patient a natural but significant improvement. And so come in for a consultation and let's see what we can offer.